Um, my name is Taylor Shinholt. My display has my maiden name, so apologies there. That's the one thing that they can't seem to figure out how to update after getting married. But I am a pediatric occupational therapist here at Kennedy Krieger Institute in Baltimore, Maryland. I've been practicing OT for 7 years, and 6 of those years I've spent at Kennedy Krieger. And I've been working with Dr. Barañano's ataxia clinic since for about 3 years now. And one of the most kind of common questions I get as an occupational therapist is, what is occupational therapy? It's kind of one of those niche disciplines where not everybody has a ton of background knowledge in the same way you might have background knowledge for physical therapy or speech therapy, where things are maybe a little bit more straightforward. So an occupation is referred to as just anything that occupies our time, anything that's a meaningful activity that someone might want to or need to do in their daily lives. So for adults, that might be things like going to work or driving a car. But when we're in pediatrics, we're often focusing on play and fine motor development and some of those emerging self-care skills, like figuring out how to put on a shirt, figuring out how to tie our shoes, figuring out how to feed ourselves with utensils, and so forth. Because we're so focused on occupations, we have a really heavy emphasis on function and participation. So a lot of times, we might see kids who maybe don't do things in a typical way, but they're able to get the job done. And we say, wow, that's great that they're able to be independent in doing it their way. And they've kind of found a nice problem solving approach to participate more independently in whatever the occupation may be. And for kiddos who are having a little bit of a harder time figuring that out, we might recommend therapy services or some strategies to start growing their independence and growing their participation and their function. So specifically when looking at kiddos with ataxia, we do a variety of assessments. So typically we will do some sort of a fine motor or developmental assessment based on the child's age. And we will take a look at those kind of fine motor coordination skills. So sometimes we'll see kiddos who have a really ataxic gait, but then when it comes to their hand skills, they do a beautiful job and their ataxia isn't impacting their fine motor skills and they're actually falling in age appropriate limits. Other times we'll have kiddos who maybe their gait looks pretty good, but then those finer coordination movements like stacking blocks are things that are really difficult for them. So that's really what OT focuses on in terms of an assessment. We often focus a lot on getting information about what the child is doing in their day-to-day lives. Are they able to write by hand? Are they feeding themselves? Are they getting dressed? Are they doing all of those sorts of daily activities to the best of their ability? And is that an area that maybe the patient and the family really want to improve independence on? For kiddos who are having a hard time with some of those activities and whose families are interested in pursuing OT services, we will often take a look at, recommending weekly therapy services here at Kennedy Krieger. Sometimes families come visit us from very far away, specifically to see Dr. Barañano. So sometimes we will help them get connected with providers in their area as well. And the intervention kind of depends on the kiddo. OT is a highly individualized discipline. And so we might look at things like improving coordination, but we also might look at things like adapting the task or using adaptive equipment to help encourage participation or improve performance within a task. So as much as we might want to improve our fine motor coordination and perhaps reduce some of those tremors, if that isn't something that works out so great after lots of practice, we might say, okay, what else can we try? Can we try weighted utensils? Can we try wrist weights? Can we try stabilizing? Can we try some adaptive bowls and plates and fun things like that to try to improve independence? So we're kind of just a bunch of problem solvers here in OT, and we get pretty creative with some of our solutions.
Thank you so much. That was really helpful. I have a 12-year-old that we've been, working all throughout elementary school on pencil grip. I think, in OT, there's so many gadgets, the weights for the wrist, and we have these a million different kinds of like little rubber things that we put on the end of the pencil to help with grip. She hasn't really taken to a lot of those. So, and now she's in middle school, so she's typing a lot more. But I've seen for a lot of Parkinson's patients, there are a number of different devices, whether it's like wristbands or weighted pencils or things that you could put on the hand to kind of help with tremor, which is like not quite as related to pencil strength and grip. But I was wondering if you knew of any, beyond the rubber things that you put on the pencil, any other like more innovative things that they've done for children, trying to work on their strength and their grip on that.
Yeah, so we often kind of refer to our hand strength as, kind of our muscles that we don't think to work out, right? We might go to the gym and do a bunch of bicep curls because we want to get our arms nice and strong, but we don't think about how much we need to work our hands. And so when we're looking at kiddos with ataxia or people who have tremors, oftentimes what we find is that their hands are pretty shaky, right? And so if you think about it, what we often see is they might incorporate additional fingers into their grasp to try to stabilize to compensate for that tremor. So it's actually a pretty cool problem solving strategy that kids and adults will do to kind of work around some of their tremors. Now, the challenge is that if we are holding a pen or a pencil like this really tight, or with all of our fingers really tight, we're going to fatigue a lot more quickly. And so that's oftentimes where we say, okay, let's figure out a way where we can hold our pencil in a different way so that we're not getting so much strain or fatigue. Sometimes you'll see like hyperextension, or their fingers will be really sore after writing for a long time because they're putting so much pressure onto the pencil. Some things that I have seen that have been helpful are weighted pencil grips. So it's kind of just like a little weighted tube. It almost looks like a piece of stone almost that you slide the pencil into, and that's been helpful. But I think one of my favorite phrases that I like to use for families, especially as we're getting towards that like middle school, high school age, is function over form. I'd rather see a kiddo who can participate in their classes and take notes and do whatever they need to do with a funky pencil grip, rather than them have a perfect grip, but that maybe lead to messier writing or slow them down, or, create an additional barrier for their engagement in, their academics. Typing is a really, really great alternative too. And I don't know if your daughter uses this, but Google Drive has a really great speech to text option too for longer essays and written assignments and things like that. So that's a tool that I have had a lot of older kiddos use as well. It's incredibly accurate for a free tool. It's actually really, really impressive how accurate they interpret speech. So the Google voice typing is something that we use a lot too.
Thank you.
Mm-hmm.
I have more questions.
Yeah. Oh, please.
Wants to chime in. So the other one was with math. So I think, we found ways through typing on an iPad or speech to text to work on like language arts and other subjects like that. But math has been the one that's been really hard, just to like find a program to line addition and division and all that up correctly. So we discovered something called KiwiWrite, which I don't know if you're familiar with that program, but it's like an online math
Kiwi like the
tool.
fruit?
Kiwi like the fruit, Kiwi, right. And it's helpful. I think it's, it's a free program, or maybe or what we have is free. So it has some glitches, but I was just wondering if this was something that you've heard of for math in particular, any tools or other apps that you've heard of that could be helpful.
KiwiWrite is new to me, but I have heard of one called Equatio. I don't think that it's free, but I have had some families have success. If your child is already set up with an IEP, reaching out to the assistive technology team at the school to see if the school district might have license with Equatio, and then you can get access to it through the school. It's kind of just like a typing app for math. I also saw that Carrie added in the chat that SnapType is a really good one. SnapType is particularly good, especially for classes where there's a lot of worksheets. You can take a picture of the worksheet and then you can type responses on it. So it's a little bit less labor intensive for teachers to modify the curriculum for students who are exclusively typing and not writing by hand. Carrie, I'd love to hear more about your experience with that tool.
Yeah, I feel like we were just losing a lot of time in the handwriting process and then getting like kind of slipping further away from the classmates, which we're already kind of far apart from the classmates, but like it was just a hard, trying to actually process like a math equation and then worry about the handwriting and the coordination and the eye tracking and all the things. It just wasn't working. So they actually ended up taking handwriting as a goal out of my son's IEP back in second grade, kind of like mid-year because his IEPs are around November. And they introduced this app, which I think is like maybe 5 years old or something. I think they might be on a newer version recently, but it's cool because you can take a picture of the worksheet. And then it works best with iPad. And so he has a school issued iPad and you can basically have a detachable keyboard if you want your child to type, or touch screen. So if it's something that has like multiple choice and you're circling, your child can just go with their finger. And I was also just impressed because he learned really early on how to like email his homework in. So like in second grade, he knew how to save a document and send it off. And then the teachers would print it at school. So he would get his worksheets with like the grading and stickers back like everybody else. But it worked like really beautifully. And the school district actually like paid for it. So it wasn't anything that we had to incorporate on our own. But it just gave him a different level of independence than we had previously seen.
Yeah. And oftentimes I find working with families, they are open to assistive tech to an extent, but they also still really want their kids to write. And one thing that I always like to recommend to families is it's okay to still work on handwriting. It's okay to still practice it, but separating it from that academic demand is sometimes really, really helpful. So can we do Mad Libs? Can we write knock knock jokes? Can we write silly sentences? Can we do all of these sorts of kind of more play-based writing activities? And then remove handwriting as a barrier for some of those more tough academic things, because academics are hard, even when we're typically developing, even when we have no atypical movement patterns. It is really difficult to figure out algebra and long division and spelling words and all of that. So can we remove the demand of handwriting so that they can more readily access that academic material, while then still practicing handwriting in a context that's a little bit more fun and less brain work and more eye hand work. And it sounds like, Carrie, that your son's school met you in the middle there, which is fantastic. That's great.
Yeah, and we definitely still try to like make him write his name on everything, but it looks very chicken scratchy, and I think it just sort of like gave some relief to everybody, like not just Jack, of course, but like the team, like forcing this on him. And he was really I think it was frustrating and it was holding him back from the actual just like enjoying learning. So, initially it felt weird to take it out of the IEP because you're like, I want him to handwrite. But, but I think it ended up really helping him kind of flourish. And it's been such an easy app as he's transitioned through the grades and different resource teachers and occupational therapists. Like everybody has been able to work with it really easily too.
Yeah, thank you for sharing that.
Sure.
Anybody else have questions, assistive tech or otherwise?
Does everybody's child have an occupational therapist that they're working with?
Either through school or private therapy?
I guess I have a question.
Yeah.
So my son Jack's 10, almost 11. And so I feel like the last couple of years we've we don't want him just to, like coming home from school and doing therapy like in our basement. And so we've tried to shift and do other things that are activities that therapy is like kind of baked into, like the hippotherapy, which is the horseback riding therapy and things like that. But we're still really struggling with like buttons and snaps and like the everyday stuff. And I don't know if you have any tips for what we should be doing, because back when we actually had our private coming to our house, it was more play-based. Now we're kind of going towards that, like we're really not age appropriate with like the dressing and that stuff. And obviously we've just bought like sort of clothes that work around that issue, but is there, are there other solutions for working on that fine motor, those like kind of everyday skills that are important?
Yeah. So I think there's a couple layers to your question. The first is that as kids get older, we do move away from that kind of play-based therapy and more to like, okay, what do you actually need to do on your day-to-day basis, right? And so it's very natural for parents to kind of have this transition where they're like, okay, we want to do stuff besides therapy after school. Some families, that time comes around kindergarten. Sometimes it comes around middle school. It kind of just depends on the family and the kiddo. So what we typically do here at Kennedy Krieger is for older kiddos, we will work in kind of what we call episodes of care. So, I have a young kiddo, or sorry, I should say he was a young kiddo when I first started working with him. He has gotten much bigger since since I first saw him, but he has ataxia, and so we were working on kind of our handwriting, fine motor, those sorts of things, and now we're kind of focusing more on like shoe tying and all of those more functional skills. And he comes to me about every 6 to 9 months or so, and we work together for about 3 months on 3 to 4 very, very functional goals. So his primary caregiver is his grandmother, and she will come in and say, Miss Taylor, I'm losing it with the shoes. I cannot tie this kid's shoes anymore. I'm getting old. My back hurts. I can't do it. You have to help him tie his shoes. And so I say, okay, we're going to tie our shoes. And that's what we focus on for that 12 weeks or so. Those sessions are really, really targeted and focusing on specific intervention. Now, this boy in particular was able to eventually learn how to tie his shoes, but had he not, we would have, maybe spent 6 to 8 weeks really working on shoe tying. And then maybe those final 4 weeks or so, 6 weeks or so would be focused on exploring different adaptations if we really weren't seeing any sort of progress. So I think it's important to try to get the kiddo to be independent without modifications first, but also be open to modifications or adaptive equipment as needed. So to kind of answer your question specific to buttons, one thing for kids who struggle with buttons that I always recommend is that when parents do laundry, because I'm sure your son is not quite doing his own laundry just yet, don't unbutton the whole shirt every time he washes it. Just enough buttons to get his head out is all he needs. And so things can get washed and dried and hung back up in the closet with just a couple buttons undone for him to get his head out. Then there's a tool called a button hook that can sometimes be helpful for kids and adults who struggle with some of those more fine motor details activities. So a button hook, basically you kind of push it through the buttonhole, you grab the button and then you pull it through on the other side. It has a little small wire loop on the end of it. And that's something that I've tried out and had some success with for kids. Sometimes kids are not so thrilled about using adaptive equipment, and sometimes I struggle to find a better word than threat, but the threat of being like, okay, well, if we can't do it, we're going to have to use the button hook has sometimes really given them the push to be like, okay, I'm giving 110% effort into figuring out how to do this button with my fingers because I do not want to use that dumb hook she keeps trying to have me use. So it just kind of depends on what the kiddo's ability level is and their motivation. And then, if the button hook or any sort of adaptive equipment is still really, really a challenge, sometimes then we'll look into adaptive clothing like magnetic button-up shirts and things like that that are a bit easier to independently manage.
Thank you.
Yeah, you're welcome. Don't be afraid to take breaks from therapy. That's like my biggest thing. It's really, really important for kids as they get older to take breaks from therapy. I typically do not see my kids more than, I would say over 10. I typically don't see them for more than 3 to 4 months out of the year. And those few months that we're working on are very, very targeted functional goals. What do you want to do? I want to make a peanut butter and jelly sandwich by myself. Okay, that's what we're doing.
I have a question. Alongside of I'm hiding on the stairwell because I have a kid that's homesick, so we'll see if he finds me here. But our son was diagnosed with Friedreich's ataxia this year. He's 10. His progression seems high because he went from in the springtime writing really well, and now it's chicken scratch. So I feel like I just typed in all these apps because we're trying to figure out as we go really quickly, because he's progressing that way. 2 questions. First one, you talked about you only see kids for a certain chunk of time out of the year. When they're not in physical therapy or occupational therapy, what do you suggest? What activities do you suggest to kids with ataxia to do that's not therapy, but also therapy, at home and stuff? We took Brennan out, our son, this summer. We decided it was way too many doctor's appointments and it was too stressful. So this summer we just did a lot of activities as a family. Now that he's back in school, though, it's a little bit more sitting and things like that. So what would you suggest if we're not going right back into OT or PT? What other activities do you suggest?
Yeah, so I think it depends on your goals. So, I described earlier a kiddo who wanted to learn how to tie his shoes and who wanted to learn how to make a sandwich. So I would kind of focus on working those functional activities into the daily routine. So, okay, maybe we're not having a peanut butter and jelly every day, but can you spread your butter on your pancake when you make it in the morning? Those sorts of things, kind of embedding those functional independent tasks into the daily routine. If you're particularly worried about handwriting and wanting to focus on that, the good news is that if your child is in school, he's probably getting a lot of practice of handwriting during the hours that he's at school. In terms of things at home, I would really try to make it play-based and function-based. So things like filling out Mad Libs or coloring pages or mazes, those sorts of activities that involve pencil control are really great to practice to keep up our skills. And then I think it's really great too, especially it sounds like since your son has a more recent diagnosis, looking into some adaptive sports programs, if sports were something that he was interested in the past, might be a really great area to explore. Here in Baltimore, we have a affiliated organization called Bennett Blazers, and they have a really great adaptive sports program. So oftentimes our kids will kind of take a break and do swim lessons with them or do basketball with them or a different sort of sport activity just to kind of stay active. So that's an option too, to look into some adaptive sports programs for the months. Or I think Carrie mentioned earlier, hippotherapy. That's another great one. Horse riding is a great option too.
Yeah.
Okay.
More from
oh, go ahead. Sorry.
Oh, sorry. I was just gonna say more from a physical therapy perspective. We love activities that really promote core strength and stability. So the hippotherapy, swimming, swim lessons are fantastic. Depending on a child's level of ability and function, sometimes martial arts are really good if they're functional enough to do that, or movement classes, gymnastics classes, things that are fun. They might be a little challenging, but they can still, make progress with.
Okay, that's very helpful. I'll look into those. My last question is, I've noticed with Brennan in the morning and night, his balance, his equilibrium is off more so as soon as he wakes up, and then at night when he's really fatigued. What are some things that you have seen that help him transition into the day? Like trying to get his motor skills working, trying to get his tremors to calm down a little bit. Like if you were to advise somebody, we're doing trial and error over here, and some things we're finding that works, but I am sure there's a lot more experienced moms out there who have a system to help their kids kind of get into movement. So I'd love to hear what you have.
Yeah. So my biggest piece of advice would just be to work in a bit of warm-up time into the day. So that might mean that, Brennan isn't able to wake up 5 minutes before he has to be out of the house. Maybe we need to set an earlier alarm to kind of give him time to warm up his muscles and take it slow throughout the day. I'd be interested to hear, I personally am not a parent just yet, and certainly not a parent of a child with ataxia. I'd be interested to hear what other moms have found as well, if that has been something that's been a challenge in your families, because I would love to have some additional recommendations to pass on to families.
So when my daughter was younger, one of her therapists recommended this little white brush. It had like really fine bristles on it. And they said in the morning, do you have the same one, Carrie? In the morning when she was,
Yes.
I have the same experience where like warming up in the morning just took longer. They said, oh, if you use this brush and like go down her arms and up her legs, it's almost like a full body massage to get her nerves running. I'm not sure what the science is behind it, but when she was little, we did that like just for a couple of minutes before she got up and ready for school, and it seemed to help. The brushes, yes.
Protocol. Oh yeah, I was like, it's some protocol. The
Yes,
Wilbarger, like
the
yeah, there's like
Wilbarger protocol.
there's like a whole like yes series of order of how you're supposed to do it and everything. We haven't done that in years, but we back in the day, yeah.
My
It was
understanding of it is the research was initially done on that tool to work with kiddos who have tactile defensiveness, actually. So kids who like don't like the feeling of clothes on their body, you would do the brush as kind of a little bit of a warm up. It's been widely informally adopted. So the research doesn't necessarily support its use across other contexts, but a lot of anecdotal evidence does. So a lot of families report some success with using it as kind of a calming strategy for kids who get overstimulated. But now it kind of sounds like it's been a nice kind of alerting strategy for kiddos who maybe have those more fatigue in the morning to get them up and going. That's a great use of the tool. You can get them on Amazon for cheap.
Yeah, but we know, fatigue, everything is worse with fatigue. And we know that our kids with ataxia fatigue faster. It's like we have a certain pot of energy for the day, and it just takes more cellular energy for them to coordinate their nervous system. And so kind of recognizing that in terms of saying there are times of day that we're less likely to be successful at doing things, incorporating rest. And sometimes, sometimes we even will try like stimulant medications as a child's disease progresses, as if it progresses, to help with kind of alertness and fatigue, is sometimes like medication-based strategy.
And then if there's also concern for falls, especially if balance continues to be a concern, I'll often have kids get dressed while sitting down, either like on a little stool or a bench or the edge of their bed. Putting pants on is a challenging balance activity, and we don't want anybody busting their head first thing in the morning or ever, but particularly first thing in the morning. It's not a good way to start the day, right? And so we might have kiddos start to learn to put their clothes on from a seated position or modify the task in that way. I've had some families who kind of keep a little chair outside the bathroom door just in case, if it's a long day and the kiddo needs to style their hair or, brush out their hair or whatever it may be, they have the option to sit while they're in the bathroom to kind of conserve some of their energy and prevent falls in that way.
This is like very, I don't know, tangentially related, but we've done acupressure appointments as well, which is more like holistic, like a holistic or wellness specialist that you'd find. But we've done like every week, and then recently we've gone to every other week with a different practitioner. But I do find it really just like calms Jack, and it's mostly acupressure points plus massage, basically. And kids can work up to like acupuncture. We don't do that yet. But he seems so much more like just relaxed. He sleeps extremely well that particular night. And I see sort of lasting effects for like a couple days after it. And we had one practitioner that actually came to our house, which was great. Now we go to someone's like home studio, which is really, really nice in our town. But he very much looks forward to that. And I think it's like calling all the noise out of their busy world, so that's helped a lot too, I think, just in terms of like physically, mentally calming things down.
Someone had just sent me a link to something very similar, and it was on my like Maggie, please read this kind of list. So I'm glad you mentioned that. I'll look into that too. Thank you.
Yeah, sure.
Yeah, and we're delighted to have Taylor here, but we don't have to, all our questions don't have discussion, doesn't have to be related to OT too. So if there's anything that's on anybody's mind or questions that they want to throw out there.
Hi, I don't know. I have a question. So I have a daughter, she's 1 year old, she's a 1 year old, and she was diagnosed with ataxia type 29. And so this is, well, recently, like around 6 months ago. And I've been very worried about all the therapy that she needs. Like I want to get all the therapy in, and like I'm very concerned and looking for this and that. I just want to know how much therapy is enough. Should I be giving her like every day an hour, or intensives, things like that? Because I'm overwhelmed because I want to give her everything, and people would say like she's young, so you have to do all this so it will help her in the long term. And well, I don't really know the answer. I don't know if you can help me with that.
Yeah. Oh, go ahead, Taylor.
No, I was just gonna say the best therapy, that the correct amount of therapy is the amount of therapy that you can commit to, without being overwhelmed or without it taking a toll on your family's quality of life. And so if that means once a week, PT and OT back to back, and then we take a break over the summers because over the summers we value doing other things, that is totally okay and totally appropriate. You're right that our early intervention kind of does really push getting in with young kids. But the great thing is that you can tell your therapist, hey, I think I need a break. I would really love if we spend the next 6 weeks of you training me on things that I can do at home. So then that way, I can be doing therapy at home rather than driving, 30 minutes into the office, spending an hour or two there, and then 30 minutes home. So it's incredibly overwhelming, especially with the new diagnosis. I'm sure some of the parents here with older children remember those days and how overwhelming it can be. But the most important thing is that the family's quality of life is maintained, and that's really the most valuable thing. So don't spread yourself so thin where you're taking kiddos out of school for significant amounts of times, or passing on trips and doing important things with the family, missing family dinners. Those sorts of things are not conducive to setting your child up for a really nice, well-rounded life. The other thing that you can do is look into options that are maybe easier for you. So maybe some home-based therapies are easier than having to take your child out to a center to get intervention. So looking into that could be an option. Some families, we have a program here at Kennedy Krieger called the Specialized Transition Program, or STP. And it is 4 weeks of every day, 3 therapies, speech, OT, and PT. And sometimes families will just do that over the summer, and then they take the school year off and they don't do therapies during the school year. So that's an option to consider if you want to do a brief period of an intensive. But it's really important to kind of balance, of course, your child's needs, but also the family's needs and your needs as a parent.
Right. But is it helpful to start have more therapy when they're young, or does it affect it in a positive or negative way? No.
Yeah, so that's the delicate balance, because we know that therapy is good, but it doesn't mean that more therapy is better. And so this is something that, do you have either a child neurologist or a developmental pediatrician that is following your daughter?
Well, we did go once with a pediatric neurologist, but he's not following. I haven't been following up with him.
Yeah, so if depending on where you are, it'd be either a developmental pediatrician or a child neurologist who can, identify what they anticipate is the trajectory for your child. So we follow a child's developmental trajectory in terms of how we expect them to gain skills, and we want to make sure that they are getting enough therapy that they can achieve their predicted trajectory. And so for kids who have like SCA 29 or kids who have CACNA 1A, these fall under the umbrella of what we think of as more congenital ataxias. So these are ones where kids are not losing their skills with time. that their ataxia remains relatively stable. And so we want to make sure that those kids are on their trajectory of gaining skills. And especially with those kinds of ataxias, concentrated bursts seem to be really helpful too, in terms of getting to the next skill that you're trying to quite get to. So that would be something to consider. I think with our kids who are at risk for losing skills, though, I think more consistent, checking in and maintaining skills is more important. So it's a little different in terms of tailoring it. But where the short reason is, checking in at a relatively reasonable frequency with your child neurologist or developmental pediatrician, saying, these are the therapies you're doing. You're doing great. Your child is doing exactly as we would predict. You're achieving, her maximum potential. Maybe we can dial it back a little bit. You're doing so great. Maybe it's actually more than she needs. Let's peel something out, or let's substitute something that she might enjoy more. Let's do some swim aquatic therapy instead of formal PT, or let's swap out for hippotherapy. So kind of tailoring that to how your child is doing, making sure that they're doing as we expect.
Okay, because yes, when I went to our neurologist, I really didn't have a good experience with him. He's just like, she's gonna have a global delay, and that's it. Like, there's nothing you can do, just go to therapy. He didn't actually tell me, well, you can maybe what to expect, right? Just like global delay.
Yeah.
And so I didn't know, maybe it's another doctor could give me more of a,
so we can talk on, I know we've emailed a little bit. We can certainly talk offline and exchange emails again, and try and get you squared away with somebody, somebody who can help with that. Okay.
Okay. Yes. Thank you.
Sure. Suzanne, you turned off your mic.
I was wondering, you'd mentioned a couple times, like taking periods off. I know not this past summer, but the summer before, I had taken my son out of therapy because we didn't have any way to get him there. And it took a year to get him back on the schedule for speech. It didn't take quite so long for PT and OT, but there was still, so you're without it for 3 months, and then you're without it for another month or two. How does that work? Because you make it sound like it's easy. I guess my experience here in Iowa is that it hasn't been easy.
Yeah. It definitely depends on the facility and the provider and availability and scheduling. One thing that I will often do for parents who have had similar experiences, or maybe their initial wait was so long that they're really anxious about discharging or taking a break because they're worried about getting stuck on that year-long wait list again. Sometimes I will try to offer them a time slot for months in advance, just to make sure, okay, we have this on the calendar, it's in the system, you will be back at this date. So I would encourage you to advocate, if you are going to be taking a break, okay, we want to come back in January, can we get something on the calendar for then, so that we have a standing appointment when we know we're going to be coming back for our reevaluation or to resume our services. And then if the answer is no, we can't schedule that far out, or we can't hold your spot, or whatever it may be, I would encourage you to ask for other resources too. So, okay, is there another facility that you know of, maybe closer to home, or, that might have a shorter wait list as well? But it's certainly a challenge navigating those wait lists. I totally understand. That's really tough.
Abdul, did you have a question?
Yes. Hi. Thank you for taking my calls. So my daughter was diagnosed. Actually, she's undiagnosed ataxia since 5 years old. Now she's 11 years old. So I mean, a lot of things that you guys share, we went through without, just learning by day by day and stuff like that, plus with the help of our PT and OT, like such as the pencil thing, but I mean, Sophia have Friedreich ataxia, but she also have neuropathy, so like the fatigue part of writing is tremendous. If she cannot really even write 5-paragraph essays and stuff like that. But now the challenge is more like she's 11, so she want to style her hair, and stuff like that. So do you have any tips about how she can comb her hair by herself, tie her hair, use hair dryers, stuff like that?
Yeah, so that's a great question. Typically, I will recommend some of those energy conservation techniques that I touched on briefly earlier. So I'd try, instead of her standing up at the bathroom sink with all of her tools in front of her, first of all, just starting to sit in a chair so that she's not fatiguing, especially for hair drying. I'm sure all of us ladies with longer hair know how hot and tiring that can be, right? So starting off in a really supportive environment where she's not having to stand, she's not having balance demands, any of that. Oftentimes I will also recommend that we stabilize our elbows like on the surface. So she could have like a small table in front of her, or perhaps the bathroom counter where she can stabilize her elbow there. And then that way she doesn't have to worry about using her shoulder muscles to hold up her arm, but rather the table's holding her arm and all she has to do is move her elbow and her wrist. In terms of simple hairstyles, YouTube is a really great tool that I have sometimes had to use, where I've had little girls who are like, I want to be able to do my hair with these bobble hair ties. And I'm like, I have no idea how to do that. So if she is pretty good on the iPad or on the phone or the computer, looking up some YouTube tutorials can sometimes be helpful in trying to follow along with those. But using energy conservation techniques like sitting or resting our arms or on something while we're working is really beneficial, and just taking lots and lots and lots of breaks. So if she knows that she wants to do her hair for a special occasion, or maybe picture day at school, working in lots and lots of extra time so that she can take those frequent breaks and avoid getting super fatigued is going to be really important.
How about tying the hair? It's in the back. I know she tried a couple of times, but it's, like first the loop is okay, second and third is so difficult.
Yeah.
We tried working with the PT, and also OT, but it is just, not happening, I guess. She's not that independent yet, for it to happen. But yeah, if you have any tips, I would appreciate
Does
that.
I know you said she's 11, right?
Yeah.
So hopefully not too old to be totally outgrown with dolls. But practicing on like a doll or a Barbie can sometimes be a good way to kind of figure out and see what's going on in front of us and how our hands need to move, and then trying to do that without sight on our own hair. So being able to practice on a doll, or sometimes there is a big hairstyling Barbie doll that's like almost like a life-size head with really long hair. So that could be something that she could practice with first. The other thing is, if she's having a hard time with the hair tie, wrapping it around and around, trying a claw clip might be easier for her, where she can gather up her hair and then just clip it into place. That might be something that works a little bit better for her.
Okay.
While she's developing the skill to tie with the hair tie. But practice. Yeah, that's really the big thing.
All right. Last question would be like, so we've been seeing PT and OT since she's 5, right? I'm having a little bit nervous breakdown because the OT keeps saying, okay, she can kind of like completed all the goals, and we probably have to like see, maybe see you once a month, or maybe once a year, and we used to see her once a week, right? So she's working with a fine motor skill, do all the kind of exercise and activities, and then also like okay, how do you button your shirt, like how you said, like using the hooks and stuff like that. How do you brush your teeth, a lot of skills, right? How do you step into the shower, stuff like that. But I am kind of worried that, we are running out of goals, right? But, as she's growing older, there's new goals and new challenges for her, right? What is your suggestion, like, for me to, tell my PT that I do need her help, and I just don't want to be cut off?
Yeah, Yeah, absolutely. So I can't speak too much to what a PT might do, but for OT, I
I'm
would.
sorry, OT, yeah, OT.
That's okay. Yeah. I mean, tying up her hair is a really great goal to bring to your OT. That's actually a perfect OT goal. It's what we call an activity of daily living, or an ADL is hair care. So I would tell your OT like, hey, okay, we've achieved this set of goals, but now we want to work on having her brush and style her hair into a ponytail. Can we work on that? The other thing is, I personally find that it's more effective for families to take a break for a few months and then come back and work weekly together for a few months in that kind of concentrated frequency. That tends to work a bit better. We have some better results rather than kind of just checking in periodically. So if you feel like your OT is really pushing like, hey, I think we're ready for a break, then maybe you say, okay, well, instead of decreasing to monthly, can we take 2 to 3 months totally off and then plan to come back with new goals on a weekly basis for 2 to 3 months following that. And I would, again, really encourage you to make sure that you have something on the schedule before you say goodbye to your therapist. That way, that they are going to be able to pick you guys back up in the time frame that you're hoping for. But I would rather personally see kids take a nice long break where they have no therapies, and then, coming back up and coming in for a concentrated frequency rather than kind of just going once a month, every other month, every 3 months, and so forth.
Okay. Thank you so much.
Yeah, you're
That
welcome.
give me some relief that,
Yeah.
Yeah.
because we really depend on, all these guys, right, to give her help. And, like for example, the hair tying, right? So she did went through with the OT, right? For, I think 6 months ago. And then, okay, she can at least put a bun, right? It's not perfect. It's not going to be perfect, right? At least she can put a bun, she can put a shower head, and then she can go to shower. That's, something that achieve a goal for your daily needs. And then she said, okay, we already complete that one. So what else do you have? Things like that. Even like fork and spoon, chopsticks, knife, we did that folding clothes. I don't know what else.
Yeah, exactly. And like you said, oftentimes as kids age, they come up unexpectedly. And so if you're on a break from OT, I always tell families to keep a running list of things that they want to work on when they come back. Over the 6 months that we were on a break, we realized that cracking an egg is really hard. Let's work on that. We realized that, cutting with a knife is really hard. Let's work on that.
Right. For fine motor skill, any activities that you can give me suggestions?
Oh, I'm so sorry, Abdul. I think you broke up for 1 second there. Fine motor skills, any activities I'd recommend, and then I didn't hear the rest.
Yeah, suggestion for fine motor skill exercise, or something that I can tell to my OT that maybe can, work on.
At your daughter's age of 11, I think focusing on the functional tasks is going to be really key, unless there are specific hobbies that she wants to do that she's having a hard time with. Like maybe she really wants to, I don't know, learn how to paint by number and the control of the paintbrush is really difficult. Or I really want to learn how to do more detailed beading activities or crafts, those sorts of things. But I would, at her age, focus more on task specific things and kind of see, does your daughter really want to do some more specific fine motor activities, and then bringing that to the OT. Hey, my daughter wants to learn how to do X, Y, or Z. Can you come up with some strategies to help her participate in that meaningful occupation?
Good point that you brought up. Like, I remember now the beading activities. She did that, like, I think at 7-year-old, drawing activities, Lego activities. Yeah, but yeah, now she's 11, so.
Yeah, interests kind of shift.
Yeah, Carrie just posted a site that I just pulled up that looks great. It has some adaptive equipment for grooming, and they're specifically like long, like a dryer stand, so you don't have to hold up your dryer, long-haired combs. So thank you for that resource, Carrie. That is great.
Thank you.
Okay, all right. I know Elizabeth has a question. Heidi has a question in our last few minutes. let's see, I think Heidi, do you want to share your question with us? And then we can get Elizabeth's question.
Yeah, thanks. So my daughter has got 29, and just going back to the fatigue, she's very tired. Like she's going to school, she's 5, she's going to school, but she's always very tired. So I was wondering does she need to have specifically more sleep than another kid, like, you know, an extra hour or two? Like, is there actually that much more, or is it just like I don't know.
So oftentimes kids actually do need more sleep than kids without ataxia. So, take your cue from her body rhythms, especially, on the weekends, if she's sleeping in, much past her usual arousal time, that you have to get her up for school, that's a sign that her body needs more sleep. Okay. So for sure, sleep is super important and very common that kids need more sleep.
Okay, thank you. The other, just a quick question is there any nutrition like that? Oh, she should be getting, specifically more of certain vitamins or anything like that, or I don't know if it's just is what it is.
So that is a great question. There are no supplements with the exception of a couple of like specific genetic disorders. There are no supplements that we routinely recommend that we think would be beneficial, but if parents are interested in trying something, and if it's not going to be harmful, we're generally always supportive of that.
Thanks. Yeah, thank you very much. Appreciate it.
All right, Elizabeth.
Hello. I have my son Alex. He's 12. From my understanding, we believe the ataxia he has, I don't know if that makes any difference, is the number 5.
Okay.
Yeah, it's something related with SPTVN2. And a question that I have in that genetic test, I was told I had the gene too, but he's like, we both have them duplicated, but I don't have any symptoms of the ataxia and he does. So I was just wondering about that. And my second question was actually, I always had difficulties with the educational services for Alex with our public and private schools. So we had to homeschool all this time. But he finally joined a virtual school that has been very good for him. But my forever difficulty with him is the typing and the attention to task. What can we help him with? What type of he has been in OT forever. Sometimes I believe we keep continuing working on the same thing. Finally, we stopped using the swing because the kid actually said, I don't want the swing, it gets me dizzy. So, big ups for him. He advocated by himself. But that's about it. Those are my questions. And I'm sorry that it sounded like more than what I needed to ask.
Well, I can address the genetic testing part briefly, and then I'll let Taylor field the second part. So without reviewing your specific genetic testing report, I can't really comment specifically other than to say that with some ataxias, there's what we call variable penetrance. So a parent may carry the change in the gene without having ataxia for reasons we don't understand, or they may have much milder symptoms, or their symptoms might develop much later in life. And so without understanding the exact kind of change to predict what was going on in your family, it's hard to comment specifically other than to say it happens. It for sure happens. Okay. And I'll turn it over to Taylor.
Yeah. And then just in terms of typing, you're right that sometimes we focus on these skills for a really, really long time. So I'd bring it up to your OT to say, you know what, we've been working on typing for a really long time. It doesn't seem to be going anywhere.
Oh, no, they haven't ever worked with typing with him. I often tell them, but they want to go back to the fine motor task. But I want more consistency when it comes, because he's 12, and I know he has the ability to answer a question, and sometimes he struggles because of his dysarthria to verbalize the answer. So I came up, maybe he can just type it in case that, to complete his homework independently. That would be very helpful too. I think all we need for him right now is to type.
Yeah, I'm going to put in the chat a really great typing program called typingclub.com. It's not specific for any particular movement disorder, but it is just a great universal tool to learn to type and to learn to type quickly. It has some games built in, so you might want to try having him practice that on a regular basis. And did you also mention attention to task as well?
Yes, yes. I know we did an IQ test and, you know, there is some delays on that area, but I think he has come a long way.
Yeah.
We noticed that a lot this year.
Yeah, I have had families that I've worked with closely. You know, as an occupational therapist, I can't diagnose anything or prescribe any medications, but I have had families over time who have found success with stimulant medications to help improve attention to task in their kiddos who had ataxia and also some attention challenges. So if that's something that you're interested in exploring, I would talk to your neurologist to see if you could get a referral place or if they could prescribe that themselves. I don't know, Dr. Barañano, what your thoughts are.
Yeah, so yes, that is exactly what I would say, is that there's definitely sometimes pediatric, you know, in practice patterns differ. You know, if it's just a kid who's, you know, doesn't have ataxia but has attention issues, many pediatricians are very comfortable prescribing stimulants. You know, they require pretty frequent visits for, you know, like every 3 months, you're going to the doctor to get weighed and measured, check your blood pressure, make sure check in and see how things are going. With our kids with ataxia and who are more complicated, sometimes pediatricians kind of shy away from that a little bit. And so sometimes you may have to push, or, you know, some of my kids, I prescribe their stimulant medications for because their pediatricians just feel so uncomfortable with it. So you know, you may have to push a little bit for it and just say this is.
We have tried Vyvanse, but never did anything really on Alex. We didn't realize any difference. It just helped him. We're not. He's not overweight, but you know he loves to eat. It helps him with that, but I didn't see any difference on that area.
Yeah, so it's the art of medicine. It's a little bit of trial and error, finding just the right flavor of stimulant medication and the right dose, because everybody metabolizes it a little bit differently. So just because you didn't have a good experience with the first medication that you tried, it definitely is worth reapproaching, trying a different variety of it, you know, working on the dosing. We can oftentimes get things a lot better in terms of attention and energy with some of these medicines.
Okay. Are there any neurologists in the area of Florida, like Fort Myers, Lee County?
You know, that's a great question. If you shoot me your email, I can follow up with you and see who I might recommend in that area.
Okay. All righty. I will send that email. We always had the same one, but
here, what I'll do is I'll put my email in the chat. So anybody who has any questions that I can help follow up on in terms of accessing resources or getting you connected with somebody locally, those kinds of questions, you feel free to shoot me an email. Give me a day or two to get back to you though.
Okay, thank you.
Well, it looks like we're at the top of the hour now. Thank you all for joining us and great questions. This was a really helpful topic. So thank you for your time and joining us as our guest speaker today.
Thank you for having me. This was great.
Great. So next session is on November 1st at this time. 1 p.m. Central, 2 p.m. Eastern. And folks are joining from all over the country and some international locations as well. So we hope to see many of you back again. All right. Any final questions, Kristin or Taylor?
All right, well, I'm gonna hop off because I have another Zoom coming up, but it was so good. Thank you everybody for joining. Hope we see you next month.
Sounds good.
Bye.
Take care, everyone.
Bye. Thank you guys so much for having me.
Bye.